The importance of osteoarthritis disease, its risk factors, clinical presentations, and diagnosis.
Osteoarthritis Part 1. Hello and welcome to the Lancet Summary YouTube channel. In this channel, we create contents about medical hot topics published by the Lancet journal. Dr. Salamati, would you please explain why it is important to talk about osteoarthritis and which joints are mostly affected by the arthritis?
Actually, experts estimate that about 600 million people have osteoarthritis, so it's a common disease. Also, the trend of the disease is increasing due to aging world population and increasing obesity among people. Moreover, the costs have increased because of increased medical expenses and decreased work productivity. And research shows that knees, hands, and hips are the most common and prevalent joints that have osteoarthritis respectively.
Would you please describe the risk factors that contribute to the development of osteoarthritis?
There are a host of different risk factors producing osteoarthritis. Overweight and obesity can create osteoarthritis through various mechanisms. Overload on joints can create osteoarthritis, particularly in women with decreased muscle mass and high adiposity. A recent systematic review shows that knee extensor muscle weakness can produce knee osteoarthritis. Also, overweight and obesity can cause osteoarthritis through metabolic effects. Furthermore, genetic and familial items can create osteoarthritis, especially in spinal, hand, and hip joints. Likewise, in many times there is a trigger for producing osteoarthritis like a trauma, and this trauma can be a microtrauma. Another variable is intestinal microbe. I mean that some intestinal microbes can produce and can harm our immune system, and in the next step they can cause osteoarthritis. And of course, there are some other variables producing and interfering with osteoarthritis, such as aging, female gender, some types of lifestyles, and socioeconomic status.
Please explain the clinical symptoms of osteoarthritis.
We can categorize osteoarthritis symptoms into two different groups. First, for those disease joints, and second, for joint-specific symptoms. For the first group, there are some joint pains that they can increase with physical activities. They are chronic and stiff after immobilization. Patients with osteoarthritis have decreased mobility, self-care, household work, and leisure activities. And there are some other symptoms like fatigue, sleep disturbances, depression, anxiety, joint tenderness, bony enlargement, deformity, malalignment, and soft tissue swelling. For the second group, I mean joint-specific symptoms, it depends on each joint.
How can osteoarthritis be diagnosed?
Experts believe that with evaluating clinical manifestations, history of disease, risk factors, and clinical examinations, physicians are able to diagnose and treat the disease. And there is no need for laboratory tests and more imagings. Nonetheless, there are some circumstances that we need more evaluations. For example, when physicians are suspicious about the diagnosis, when the pain is intense, or when the process of disease is so fast, or when there is a history of trauma, that in these conditions we should take radiographs. So radiographs mostly are enough, but in some sophisticated situations that they are out of our scope of this channel, we need more evaluations.
Thank you for sharing your explanation. In this video, we discussed the importance of osteoarthritis, its risk factors and clinical symptoms of this disease, based on an article entitled Osteoarthritis published by the Lancet journal. This channel is here to talk about important medical topics, including new research from the Lancet journal. Don't forget to like this video, leave a comment below and subscribe to our channel.